everybody, really excited to be here today with Carlos Yerena, an old school buddy of mine. He's not old. We've been friends for a while.
Also old. Getting there.
He is the Director of Strategy and Partnerships at Reach Digital Health, a wonderful South African organization. And we've been talking a little bit about some of the ways that Reach Digital Health is working with language technology. It's super interesting. Hey, Carlos, thanks so much for being here.
It's a pleasure, Aimee. Thank you for reaching out.
So what do you think is interesting?
Well, many things. As I was sharing earlier, I think when we speak about voice, we see it in two ways. So we always speak about multimodal, multi-channel.
Right, of course.
And it has to do a lot with accessibility, providing different ways. I always share the example of my grandmother who's 87, and every morning from Mexico, she sends me a voice note. At this point, she's struggling to type, but she can easily send me a voice note every morning, right? Yeah. Nice. And so what we're trying to trailblaze a little bit now at Reach Digital Health is that component, multimodality. Not only the capacity for you to send a voice note and then get an answer in your language.
In your language, right?
Of course, a lot of the communities that we serve, and that's where we see a lot of your work being really impactful and complementary, have these underserved type of languages, right? Not the large language models that English, French, Portuguese, Spanish will give you, but Hausa, Yoruba, even some local languages in Mozambique.
Sure.
So the ability for somebody to, ask a question in the language, get an answer in the language, as the famous quote goes, what it says, speak to a man in a language that he understands, it goes to his head, speak his language, it goes to his heart. Right. So it's super important that we get that right, and I think that's one of the most exciting things coming up for us with AI and voice.
And why is that sort of interesting for Reach Digital Health?
Well, inclusion is a key aspect of the work that we do.
Sure.
Inclusion can look very differently because it's not just the access to a phone or WhatsApp. No. It's actually how you then engage with that person. You can have access to WhatsApp, but if you're just sending somebody a 20-page PDF for them to read in their language and expect to change that's not going to work, right? Yeah. So for us, inclusion, we think the design of what we build is companions and these sort of, conversational agents is super important. Yeah. So the ability to have this in local languages that they understand, it's part of what drives us as well.
And what impact do you think that's going to have?
Well, for us, ultimately, is the fact that if we are trying to get to the heart of somebody, that speaks to another core component of our work, which is the social behavioral change that we're trying to achieve at the end, right? So we are very sensitive to the fact that just pure translation from one to the other might not get you to the actual message that you want to get across, especially on topics that are quite... they have a little bit of a friction. So HIV, TB, sexual reproductive health, sensitivity, gender-based violence. Yeah. You really want to get it right so that the message really gets across and it has the impact that it was. Because ultimately, we're speaking about scale, right? Millions of people using WhatsApp or whatever, but what are they doing with the information that we're sending them? Yeah. Ultimately, for us, is increasing breastfeeding, even condom usage, things of that nature that are very delicate. Yeah. But that's where we see the biggest impact from the work that we do.
Wow, you guys are doing such amazing work. You're a great partner. Really appreciate it. And great to talk to you. Thank you so much.
Great to see you. Thank you, guys.
And that's what's interesting.